Hi there, my name is Jack, and today we'll be going over how to do an effective group log roll. We'll also be talking about what a log roll is, the log roll compared to other types of patient movement, and when you would want to do a log roll. So what is a log roll? The log roll is a technique that we use to turn a supine patient onto their side. Compared to other types of patient movement, the log roll is preferable because it keeps the patient's spine in line and reduces the risks of any further spinal injuries. But when would you log roll a patient? We typically log roll a patient with a suspected spinal injury if we need to move them off the ground or need to assess their back and spine for any injuries, or even if they're vomiting. Oftentimes, we also log roll a patient to put items underneath them. In an urban setting, this might be a backboard or a sheet, but in a wilderness setting, this can be a sleeping pad to reduce the risk of hypothermia, and even a litter for extrication. I will now be showing you how to do an effective group log roll.
After deciding to log roll the patient, some other things to take into consideration are if the patient has any injuries that would prevent turning to that side, or if there are any environmental obstacles that would prevent turning. In this case, the patient will not be injured and will be on a flat surface. To help facilitate the roll, we put the arm that would be underneath the patient over above their head, and we cross the opposite leg onto the side that's being rolled towards. In this case, we're rolling the patient to his right side, so his right hand is above his head, and his left foot is crossed over his right. An effective group log roll is best performed with at least 3 providers. One provider to hold the head to protect cervical spine and to give commands, one provider to stabilize the torso, and one provider to stabilize the legs. Major landmarks that should be secured include the head, the shoulders, the waist, and the lower legs. As seen in this picture, the 2 providers at the body should cross their arms at the waist to provide a more stable roll. If patient clothing allows, the waist can be further stabilized by grabbing onto the belt loops, but not a belt itself. The provider at the head will give instructions for the roll, ensure crew readiness, give a countdown, and then the patient will be rolled as one unit. When rolling, the head and neck should remain in an inline neutral position with the body. Preferably, a log roll should be done with some sort of external spinal immobilization. You will now see an example.
On my count, we're going to be rolling him to his right. Does anyone understand the plan?
Yes.
Anyone not ready? On 3. 1, 2, and 3.
At this point, you can assess the back and spine for any injuries.